So let's talk spending for Medicaid and healthcare and how that's going to be impacted under Trump. I have pulled up a resource called kff.org. This organization has been around since 1947. They are a nonprofit watchdog organization that basically deals with all things Medicaid and healthcare related. They published an article in June that estimated that $793 billion would be saved by the spending cuts through these new bills that are being passed through Congress and Senate. Now, the five biggest sources of Medicaid savings that they mention, of those five sources, three of them really get to me. The first one, mandating that adults who are eligible for Medicaid through the ACA expansion meet work and reporting requirements. This is estimated to save a supposed $344 billion. However, if you are, let's say, disabled or living with some kind of chronic illness, or even if it's difficult to find work right now because of artificial intelligence and everything else, if you're using Medicaid as a lifeline, this is going to impact you. And you need to pay very close attention to what's being passed and how it's actually going to impact the larger part of us. Now, the second thing is that they are going to be repealing the Biden administration's rule, simplifying Medicaid eligibility and renewal process. There's a lot of ambiguity surrounding that. It's estimated to save around $167 billion. Now, my biggest concern here is the simplification of these rules has allowed for more people to get covered for more things, especially if they're chronically disabled or if they have a chronic illness, or it allows for people to just exist. Sometimes people need a break, and if you are sick and you are having difficulty maintaining work, Medicaid will be a lifeline. What if you're low income and you come from a low income family and you're doing your best, but you have something like diabetes, which requires constant medication? You're going to be spending a lot of money if you're not insured. Medicaid is a lifeline for these people who are trying to build themselves up, or just these people who are trying to exist. It's not fair for us to tax people just for existing. The next thing that they're going to do is increase the frequency of eligibility redetermination for the ACA expansion group. So I am somebody who works in healthcare. I understand a little bit about how healthcare works and how the insurance industry works. Now, the biggest issue here is that a lot of the eligible determinations are made on a yearly basis, based upon previous year's reported incomes and things of that nature. You might also have children with special needs that are eligible for Medicaid programs through state-funded insurance. How is this all going to impact them? There's a lot left to learn, and you can stay tuned for more because I'm going to be following this very closely. I work in behavioral health. I have a master's degree in special education, and I work with children who are diagnosed with autism, and I'm working with their behavior in a clinical fashion. Now, we work with a high Medicaid population. I'm not concerned about our income because we can still take private insurance. It's not about income. I fear for the lives of our clients and what's going to happen to their families through all of these spending cuts and through everything else. If you are an immigrant, even if you've done things according to their way, and you're doing the right thing, and you have a child with special needs, that child deserves access to health care. Even if you're not rich, you shouldn't have to be rich to have an illness treated. We are better than this, America. Let's wake up and do things the right way. This is David Harrison Greis of the Greis Report, signing off from New York City.